Get. Awesome. Well, good afternoon, folks, and thanks again for joining us for this webinar series. In the first part of this webinar series, Referral Systems for Adolescent Sexual Health Services. All right, just wanted to share a quick disclaimer before we get into our session this afternoon. The development and presentation of this webinar was supported by the cooperative agreement that you see listed here with the Centers for Disease Control and Prevention. The opinions, findings, and the conclusions do not necessarily represent the views or the official positions of the CDC or Department of HHS. This is primarily a presentation from the National Coalition of STD Directors and CAI. Just wanted to share a few quick reminders for folks. As you all see that you all have the capability to turn your cameras on and off, so we encourage you to engage with us as you see comfortable. But folks are currently in listen mode only. To ask a question during the session, please feel free to drop a question into the chat or utilize the Q&A function icon that's on the bottom of your Zoom control panel. If you have any accessibility needs, please feel free to privately message Elizabeth or myself, and we'll be happy to support you with that. And if you'd like to turn on closed captioning, there's also an icon on the bottom of the Zoom control panel. We'll have some time at the end of the presentation for Q&A, so we ask that you keep your questions either to the chat or the Q&A function until we get to that point in the webinar. We also want to add that this webinar is being recorded, so be on the lookout for the recording and the slide deck that'll be emailed to all folks that registered for this session. We'll also have these materials posted on the NCSD and CAI websites. All right, I just wanted to share a couple of objectives for our time together. We hope that at the end of this presentation that you'll be able to understand the overall purpose and intent of the Referral Systems Toolkit, understand some key components and some of the updated information that you'll find in the newly released version of the toolkit, and learn some strategies and best practices for creating a new referral system in your jurisdiction or revamping an existing one. The purpose of this webinar will be an informational webinar based off of the new toolkit, and so folks I know shared some specific questions while registering, and you might have questions throughout this presentation. And while we might not be able to get to every question, know that this is the first of many of this webinar series, and this will just be an introductory webinar to the newly released toolkit. So just something to keep in mind. All right, before we get into our session, I wanted to introduce our speakers and the presenters for this afternoon. While we're doing that, feel free to drop into the chat your name, your pronouns, and your jurisdiction and the role that you serve in your organization. But I'll go ahead and get us started. My name is Christy Altador. My pronouns are she, her, and I am the Director for Adolescent Health Policy here at NCSD. NCSD is a national public health membership organization, and we represent health department STD directors and leaders throughout the entire country, their support staff, and community partners across all 50 states, 7 large cities, and 5 U.S. territories. Our mission is to advance STD prevention programming and services in every community and jurisdiction across the country, and we do this through leadership, technical assistance, capacity building, convening partners, and advocacy. Now I'm going to turn it over to my co-partner, Elizabeth.
Good afternoon, everyone. Welcome, and thank you for being here today. I'm excited to present today with Christy. My name is Elizabeth Salner. My pronouns are she and her. I am a project director directing our school-based health portfolio at CAI. And CAI is a nonprofit organization with over 40 years of experience at the local, state, national, and international levels, helping organizations improve healthcare and social services for historically marginalized communities. And we do this through providing high quality education, training, research, and technical assistance services to these organizations to serve diverse communities. Some of our projects include working in sexual and reproductive health, maternal infant health, substance use, HIV, and AIDS. So again, as I said, it's been a pleasure to work on this referral systems toolkit with NCSD and Christy, and excited to have you here in this webinar today.
Thanks, Elizabeth. So before we get into a little bit on the webinar, we wanted to just level set with some background information on the state of STIs in adolescents. So this might not be surprising or new information, but we really wanted to just set the stage with this background information. So young people carry a heavy burden of disproportionately being burdened by STIs in the US, with young folks ages 15 to 24 making up less than a quarter of the population, but account for over half of all new STI infections in the US. So in 2020, young people carried over 50% of these new cases. And although we saw a decline in teen birth rates and being at currently the lowest record levels, there are still more than 145,000 infants born to adolescent females that we saw in 2021. So I just wanted to share that background information for folks. So earlier this year, the CDC Division of Adolescent School Health, or DASH, recently released the data survey and trends report for the Youth Risk Behavior Survey, and YRBS, also known as YRBS. It's used to highlight national data that's collected every 2 years among a national sample of U.S. high school students. So this data provides information from 2021, as well as looking at 10-year trends from 2011 to 2021 on just some of the behaviors and experiences that young people in schools in the US face related to health and well-being. So the 2021 data set, it is the data, they are the first of the YRBS to be collected since the beginning of COVID-19. So the last time that data was collected was in 2019. And so just some trends that we noted in sexual health behavior in this particular summary report is that generally sexual activity declined among all youth. So sexual activity being reported is moving in the right direction, but we also saw that safer sex practices also decline among sexually active youth. So it's definitely something to take note of and to just take stock that practices such as condom usage, STI, and HIV testing also declined. So something to look into there. And some recommended actions from folks at DASH and researchers that really participate in this work is the importance of increasing access to services, and that can be done through improving school-based services. And then the importance of connecting young people and their families to community-based sources of care. So with that in mind, I think the re-release of this toolkit is super timely given the data that we're seeing from comparing 2019 and 2021 YRBS and how systems can support young people in being referred into care. So with that, I'm going to turn it over to Elizabeth to share a little bit of background on the referral system toolkit.
Great, thanks, Christy. Yeah, so I wanted to give a little history and background of the purpose of the original toolkit, which was developed in 2016. Prior to that, from 2013 to 2018, CDC DASH and the School Health funded the Promoting Adolescent Health through School-Based HIV/STI Prevention and School-Based Surveillance project that supported 17 local education agencies that received funding to partner with priority schools and other stakeholders to develop and implement a referral system and associated protocols and resources and tools to increase student access to sexual health services. CAI was funded as the Technical Assistance Center to provide tools and capacity building to these local education agencies. And so in conjunction with CDC, we developed the core components of a referral system framework that outlines and describes these core components necessary for a successful referral system implementation. And the design of this implementation kit was informed by the Program 1308 guidance supporting state and local education agencies to reduce adolescent sexual risk behaviors and adverse health outcomes associated with HIV, STDs, and teen pregnancy. Through this project, CAI used this implementation toolkit to provide technical assistance to these local education agencies on implementing the recommended activities and adaptation of tools. So as I mentioned, this implementation toolkit was originally developed in 2016 with a focus solely on sexual health services, especially focused on STIs and integrating that into school settings. This toolkit really provides a framework for a standardized approach to developing and implementing a comprehensive health service referral system in priority districts and/or schools. So with that brief overview, I'm curious to hear from the folks in the room. We're going to do a quick poll. Have you used the referral systems toolkit that I just described? Yes, that you've used it previously and can't wait to use the updated version. No, but I know of the toolkit and have shared it with others. Never heard of it. Not sure, but it sounds cool, or it doesn't really apply to my work.
Elizabeth, someone asked, could you maybe share what CAI stands for?
Yes, thank you. CAI stands for Chickatelli Associates, Inc. So our official name is CAI. It does stand for Chickatelli Associates, Inc. And I can share our website, which is caiglobal.org, in the chat.
Awesome. So I'm going to share the results of the poll.
Great. So it sounds like there's a lot of folks in here that are new to this toolkit, new to the old one, and which means you'll be new to the new one, which is great. That's what we're really here to talk about and to introduce to all of you. So as I mentioned, this toolkit was created in 2016, which, as you know, is many years ago, as it seems. We know that the current landscape that we're in is a lot different than where we were in 2016. Schools have been and continue to be an essential setting for supporting adolescent health and well-being. These are places where adolescents are most frequently and where they have trusted adults that they can turn to with issues regarding their health, their mental health, and their lived experience. And since the creation of the original toolkit, many things have changed for adolescents in their daily lives. They've had to navigate trauma and disruptions from COVID-19 and racial reckoning in our country. As Christy mentioned, the rates of STIs among adolescents continue to be high, even though sexual behaviors are decreasing. And with that, we saw the starkest disparities among Black, Hispanic, and LGBTQIA+ youth. We also saw that the number of adolescents reporting poor mental health is increasing, especially for gender diverse and sexually expansive youth. And that rates of suicidal ideation, bullying, and substance use, again, especially for LGBTQIA+ adolescents, are of real concern. We also see that in 2021, there was a report given by the White House saying that suicide is the second leading cause of death in teens and young adults aged 10 to 24. And then finally, we also see that there's been an increase in poor mental health among youth due to the pandemic. We also saw that the pandemic changed the ways that adolescents interact with health systems and broaden access to telehealth and non-traditional approaches to healthcare. And developing a robust referral system can really help connect youth to needed services in a more effective and timely adolescent appropriate way, supporting their health now and improving their health and well-being in the long term. We know that adolescence is a time for young people to have a healthy start in their life, and supporting and connecting adolescents can really build strong bonds and protect their mental health. And schools, as I mentioned earlier, can really be these settings to have these protective relationships with students and help them grow into healthy adulthood. So with the original toolkit that we saw, or we can look at the next slide, thank you, Christy. This toolkit was really designed to help schools develop effective referral systems, including establishing policies and outlining these roles and responsibilities. And this, again, was updated to reflect this changing landscape. The revised toolkit has a more intentional focus on health equity and acknowledgement that LGBTQIA students, students of color, and other marginalized student populations experience disproportionate hardships and require certain considerations when providing referrals. It also takes into account updated data from YRBS and other data sources, and also updated language that's used in the field and respectful to youth. Terms such as trauma-informed care, health equity, and cultural responsiveness, humility, and competence are all defined in the new toolkit. We also saw the importance of having a broader focus on mental health and other supportive services beyond just sexual health services. We know that a focus on mental health, supportive services such as gender affirming care, sexual and relationship violence prevention, housing, and other basic needs and resources to address those needs were emphasized in the toolkit. We also saw the importance of having training for referral staff to have that understanding of working with marginalized populations. And then woven throughout the entire toolkit are tips and recommendations for providing referrals using flexible tools like telehealth as a standard point of care. And this is especially important during times of great disruptions, such as during COVID-19. And we don't know what's going to happen, but there might be other disruptions in the future where we need to turn to telehealth again. So we would now want to introduce our new toolkit, which on the next slide. Here's the cover image of it. And throughout today, or at the end of today's presentation, there'll be a QR code and links to the actual toolkit where you can look through it at your own pace. So this toolkit, again, provides guidance, tools, and resources to address each core component in your school setting to achieve the desired outcomes. So our desired outcomes with using and utilizing the toolkit include, so we can go to the next slide, Christy. You have the core components laid out here, and our short and intermediate outcomes include increased student awareness of sexual health and supportive service providers, increased referrals of students to sexual health services and supportive services, and our intermediate outcome is an increased number of adolescents receiving sexual health and supportive services. With ultimately our long-term outcomes of the referral system are to really decrease STI, HIV, and unintended pregnancy rates among adolescents. Another long-term outcome is to increase educational attainment and increase positive adolescent engagement in community and school. So the framework's core components do not have to be addressed in any particular order and can be worked on simultaneously or one at a time. And each of these core components listed here has a set of recommended activities and tools that each local education agency can implement, use, and adapt. So now I briefly wanted to go over what these core components are and what they really mean. So as you can see, there are 7 here. The first one is referral policy. And this section of this core component really includes an overview of federal and state laws and regulations, reviews confidentiality policies, telehealth and confidentiality best practices, minor consent, and tools on how to do a policy assessment. These really help for local education agencies to know what to expect, under what circumstances students can receive information from school staff about health services and accessing school-based health care, and be able to leave school premises to receive other community-based services. The next core component is the referral staff. which reviews how to identify, select, train designated staff to make referrals and ensuring that all staff are aware of the referral implementation process. And of course, that includes training on the referral process, how to make a referral, and training to increase their knowledge and skills to support adolescents who who've experienced trauma or have been marginalized. So topics such as trauma-informed care, adolescent development, and cultural humility, we think are great recommendations of trainings for referral staff to be provided. The next one is procedures, which provides a standardized and concise process for school staff to follow to connect students to appropriate services. With written procedures that incorporate principles of trauma-informed and strength-based approaches that will advise the referral making process with students. And of course, these procedures may vary depending on the type of referral that's being made, whether to sexual health services, mental health services, or other supportive services. The next piece is the referral guide component, which describes how to develop a referral guide, what information is needed, how to gather referrals, what services they provide, as well as knowing if those sites are adolescent friendly, if they're LGBTQIA+ friendly. And it really is an important tool for staff to select appropriate service providers for students. This can be used as a standalone resource. It can aid in raising awareness among students and other staff of the available resources to them in case students want to make a self-referral. The next piece is the communications and marketing strategies to help, again, raise awareness of the availability of both school and community-based adolescent-friendly health services. Creating a school environment that increases awareness about the availability of these services for adolescents can increase the rate at which adolescents seek care. If they know about it, they're more likely to engage in those services. And there are tools in the toolkit to really help develop a marketing plan, how to engage adolescents in this process, and to ensure that all school faculty and staff are aware. The next piece is the monitoring and evaluation plan, which we think is crucial in when you are implementing a referral system. This really helps to evaluate which the referral system is, if it's achieving its intended objectives and goals. And there are different options for implementing a monitoring system, which are laid out in the toolkit. And then finally is the management and oversight to ensure that the referral system is being implemented in a standardized manner. And again, to track to make sure that it is achieving the intended outcomes. So that is a very brief overview of all the components and the toolkit on a large scale, kind of a bird's eye view. And I wanted to just conclude this section by thinking, if you are folks that do implement referral systems in your schools, what aspect of your current referral system do you want to improve upon? We're thinking about referral policy, staff, procedures, the actual referral guide, communications and marketing, raising awareness, the monitoring and evaluation, or the management and oversight.
I'll jump in and add, as you look at these different components, where would you see that you find the most challenges in implementing in your current referral system or even revamping the one that you have existing? Feel free to share in the chat or come off of mute if you feel comfortable. But yeah, we're going to share the results in a little bit just to see where folks would like to improve on. Give a few moments for folks to respond.
Great. I think we can end the poll. Yeah, and so we see that there's a mix here. Some folks are focusing on referral policy, some on staff, the guide, and communications and marketing. And of course, there's no right or wrong answer here. It could be multiple that you want to work on. But we're hoping that this is just a taste for you to be starting to think about your system or what a system could look like in your school setting. I did see in the chat a comment or a question about how you're using the word referral, which is a great point. We are really mainly talking about external referrals to outside partners, although many schools do have school-based health centers or other services within their schools. So it's really dependent on your individual setting and what that looks like, but it could refer to both. So I hope that answers your question, Robert. And with that being said, I'll pass it over to Christy.
Yeah, thank you. That was a really good question, Robert. So for this next the next phase of this webinar, we just wanted to walk through a little bit of role playing and highlight some like a Sparks training, which is just to spark some thinking, maybe some discussion and thinking around how school staff can help facilitate access to health services, whether internally or externally. And so this little Spark training is powered by the Adolescent Health Initiative, but also in partnership with the Michigan Department of Ed and Department of Health and Human Services and CSD. So sometimes we find that school staff can play a role in facilitating that referral or linkage, but a lot of times we're finding that teachers and other school personnel are just uncertain on what they can or can't say, what they can or can't do, especially related to sexual health services like STI or HIV testing. So we just wanted to walk through an example of what folks could possibly face. I'm going to read a scenario about an interaction between a math teacher and a student. And so as I'm reading, I also have the script on the screen. Just think through how maybe just in your role, whether that's health folk or education partner or even a national partner, like how would you best recommend a person to address that particular situation? All right, so here we're introduced to Mr. Brown. I'm a high school math teacher. One of my students, James, came to me after class yesterday to confide that he is concerned that he might have an STI after finding out that his partner was with someone else at a recent party. He wondered if I knew where he could go for testing. Our school doesn't have any policies about referring students for those type of services, and I was caught off guard. This isn't the first time a student has come to me with an issue like this. I've sent others to the guidance counselor, but I recently learned that she calls their parents. James's parents are very conservative and would really be upset if they found out he was having sex. I told him I would get back with him today. I feel like I'm in a bit of a bind. All right, let's hear from the student. My name is James. It took me a few days to get up the nerve, but I talked to my math teacher, Mr. Brown, yesterday after class. I told him that I heard my partner Chris was with someone else at a party recently, and I think that I should get tested for STIs. We don't have a clinic in our school, so I asked Mr. Brown where I could go without telling my parents. They'd freak out if they knew what I was doing and that I was doing that. Mr. Brown said he understood that I needed to keep this private and said that he needed to do some checking to give me the best information. I would have gone to our counselor, Miss Wilson, but I heard that she calls kids' parents when they ask about this kind of thing. Mr. Brown has always been someone I trust, so I'm sure he'll be able to help me tomorrow. All right, so in this situation, we find and hear that many adults feel uncomfortable talking with young people about sex or sexual health services or needs. Some are concerned that talking about it will send a message that they're encouraging risky behaviors, and others may just not know what they should say or what they're allowed to say. And I think even taking into account the given political climate around comprehensive sexual health education and services, particularly in schools. Some jurisdictions are even afraid to even have conversations with students about sex, sexual health services, and referrals. We're seeing this at the same time from what we shared earlier from YRBS data in 2021 that young people are reporting that while risky sexual behaviors are declining, so are important protective factors and behaviors like condom usage, HIV and STI testing, and just some of those other services of care. So in this particular activity, um, and to help kind of understand how teachers and parents felt about school staff handling an issue like this scenario that I just shared, the Michigan Department of Ed, in partnership with the Michigan Department of Health and Human Services, surveyed teachers and parents about their knowledge, attitudes, and comfort around making referrals. And it turns out that parents in particular do believe that the school has an important role in helping students connect to sexual health services. So when looking at this particular question, um, asked whether they agree or disagree with the statement, it is not the school's role to refer students for sexual health services. Only about 21% of school staff and under 20% of parents agreed or strongly agreed, right? Now, this sentence and statement is phrased in the negative. So looking at in the reverse or in the flip, we find that most teachers and even more parents do agree and believe that the school should have a role in referring students for comprehensive and confidential sexual health services. So some of the barriers that these folks found in this survey is that teachers noted a number of reasons why they felt uncomfortable with giving a referral to students for sexual health services. So first, they felt um, they felt like they didn't have enough knowledge around this part of work. They also felt like they weren't the appropriate person to make the referral, and they were worried about repercussions from parents, school, law enforcement, and other folks that could press legal issues to those spaces. So it's really telling and reflective, especially that we know that there's a need that teachers are expressing and school staff to have more knowledge and understanding, not only around navigating referral systems so that they can provide information appropriately and safely to students without fear, but also just some of the language and talking points that they might need, given the jurisdiction or that the state that they live in. And Robert, I see your comment in the chat that, yeah, it sounds like that the 13% or the smaller percentage of parents and families that um, have a negative approach to this or disagree seem to mobilize and have the loudest voice. So, what are some strategies that we can think through for the parents that are for these services, are for referral systems and comprehensive sexual health education and services to young people in schools, creating safe and supportive environments? How can we empower and mobilize those groups to support some of this work? So with that in mind, we wanted to share some key considerations for folks that are thinking about implementing a referral system or maybe revamping, specifically around adolescent sexual health services. And this can take into consideration not just for referral systems, but any kind of engagement that is supportive to adolescent health in schools. So we know that it's important to center youth voice and engagement in this work, right? Not to tokenize youth or just bring them in to one small part of this entire project, but to include them throughout every step of the way, right? Giving them agency and autonomy to make decisions and to just share their expertise because, we know that young people are the experts of their lives. They're the experts of being young people and being in schools. And so it's so important to encourage youth engagement and consider that in looking at maybe your current referral system or thinking of revamping. We're seeing the importance of building staff capacity through training and professional development opportunities. And this can be done in partnership with other community-based organizations, national partners such as CAI or NCSD, and in partnership with the health department STI programs, right? They may have the capacity to provide some training to school health staff, teachers, and other personnel that might serve as champions in their school systems to refer young people to services. We're also seeing that it's important for folks to engage in multi-sector partnerships. So that might be a local coalition or community group of folks in different sectors like the health department, the education agency, other parent and family groups that are for some of this work and these efforts, providers, universities, youth organizations, and LGBTQ plus organizations, right? Black and brown groups and those some of those folks. It's really important to kind of gather folks to think through strategies to navigate some of the challenges and even some of the pushback that schools are facing around some restrictions around sexual health services or all sexual health needs. It's important to consider minor consent and confidentiality laws, right? Some of those talking points and tips. I'm going to drop in the chat in a little bit a tool that NCSD put together around framing and just messaging and language that folks can utilize around minor consent STI. We know that some like that has been brought up in conversation, different states and legislation, and being, should minors be able to consent to STI and HIV testing? So those are things to consider in your referral system implementation. And like I shared earlier, really involving community and parent engagement, right? That information, education, and sharing, right? Whether that's through the PTA, Parent Teacher Association, right? Providing a presentation or really gathering parents to let them know, like, hey, we want to let you know that this small percentage of parents they're informing policies throughout for every student, for all young people in these school systems. And so it's important that their voice is heard too. And the importance of just sharing data. We know that in certain areas, YRBS could be compromised or folks aren't participating in YRBS. So maybe looking at data sharing agreements between the health department and the education agency to make the case to really enhance the referral system and looking at some of those health outcome data, like we shared earlier around young people accounting for more than half of new STI rates. And so really looking into some of those data sharing practices and what might be in place there. We also wanted to share some additional resources that folks can use in addition to this toolkit that we recently released. So the National Association of School Nurses released the Sexual Health Toolkit, and it's really, really, really good, right? It's really comprehensive, and it's designed with schools and school health nurses in mind. And it was developed um, as a result of an identified need from school nurses to have an easy, accessible resource with tons of information for school nurses to access. So it has resources from publications, webinars, fact sheets, and other implementation guides. So we'll be sure to include these resources and other links in the follow-up email that all registrants will receive in the next week or so. But that's a really good toolkit to look into. Also, Project Connect, which is like a CDC project, that this implementation guide was designed for state and local health departments in mind, along with schools and community-based partners that are looking for mechanisms for linking youth into needed healthcare services. And that's been demonstrated through a research project that they conducted in Los Angeles. So that's something that would be useful to look into if you haven't um, delved in that yet. And then lastly, Elizabeth mentioned around like telehealth offerings. NCSD released a toolkit last year around sexual health telehealth services. And while it's looking at lessons learned and best practices through the COVID-19 pandemic, it is evergreen to all disruptions that could occur, that could interrupt in-person services for young people. And so take a look at some of those key considerations and strategies that are recommended in that toolkit. And like I mentioned, we'll share some of that information in our follow-up. So at this point, we're going to open up the floor to any questions that folks might have. We really appreciate some of the questions that folks sent in advance with the registration. And while we may not be able to address some of those specific questions in this webinar, since this was more informational, introductory to the toolkit, but this is part one of a webinar series. And so we'll have specific webinars with presenters that will share success stories and best practices that they've learned with implementing their referral systems and tools that you can bring into your jurisdictions that could include prep and how to deal with engaging with school administration and leadership and maybe some things around like policy considerations that folks might have. We have taken those questions and any questions you might share to inform those remaining webinars. So like I mentioned, we might not be able to address any specific questions, but we did want to open up the floor if folks have questions for some of the information that we shared about the toolkit. And while folks might be thinking through or dropping things in the chat, we wanted to share, like Elizabeth mentioned earlier, the link to the toolkit. You could access it through the QR code, and that will immediately bring it up. This will also be linked on the follow-up email. You'll find this toolkit on our NCSD website already if you type in the name, but wanted to pop this here for folks if you wanted to check that out now. And like I shared, be on the lookout for part two of this webinar series, which will look at developing an equitable and inclusive referral systems. And that's going to look at strategies to support rural and suburban youth who might be less likely to have access to some of the beautifully designed integrated teen health centers or some of the systems that we shared. And also looking at how community partners can provide care to marginalized populations.
So Christy, what's the outcome of the scenario? We're waiting.
That is a good point. You might have to join part two of the webinar to see what happened with James and Mr. Brown. But I
Okay.
think essentially the point of that training was just to get folks thinking through what are some of the best practice. So I imagine that in that space, Mr. Brown went to school staff to say, well, what's our policy? What system do we have in place? What can I share to students? What's our policy with our guidance counselor informing parents? Is that a policy already in place? Is that something that we can revisit, especially considering minor consent and confidentiality, right? Like, is that impacting some of those things in place? So I think that training was really just to get folks thinking through systems and current referral policies. Because I think, unfortunately, it's when a scenario like that comes to my play, right? Like a student comes to a school staff and it's unexpected, right? Like it's math class. You would think this isn't science. Why is someone, going to a math teacher about this? But really, we should have some of these systems already considered and in place before the student even comes to school personnel to look for help.
I want to thank you and Elizabeth both for talking specifically about adolescents, youth under 18, because I think, I guess much of the time for reasons of data collection and epidemiology, we kind of lump 13 to 25, 13 to 26 all together. And I think really, we're talking about two very different groups of people under 18 and people 18 to 26. And it, traditionally for people who lived in urban areas, it's been easier to seek services if you're an adolescent, because maybe there were drop-in groups, maybe there was a specific queer youth group in your city or something like that. Now, as I said in chat, we're dealing with some, pretty crazy politics on this right now. So if it had been safe for me to go to, say, a group like Lyric in San Francisco, which is an LGBTQ queer youth organization, it's possible that some people would show up outside to protest. And so you'd lose your privacy and your safety for going to a place like that. And, what we know about a lot of different people is that they want sexual health services, but they would like to receive them where they're already going for some other reason. They don't want to have to go to someplace different where they might not feel comfortable, be accepted, have easy transportation to get to and so forth. So that was just, sorry, that was a long comment. But I'll put a question mark at the end so that you or anybody else can react to it.
Yeah, no, Robert, thank you so much for sharing that. And it's so true. Just kind of like what you're sharing, like what comes to mind is thinking like, you know, how do we like balance between like uplifting information in schools and to young people, but then like also protecting that as well, given that if that information ends up in the wrong hands, right? Or someone that's opposing of this, like we're seeing those folks might have connection to other people in power to shut it down. Or right, like kind of sharing misinformation and disinformation to what's being provided or what we're seeing, right? Like I think just all that we're seeing around around gender affirming care around the country and some of those conversations and folks sharing misinformation and disinformation around that. And, you know, if we're trying to create an inclusive system that supports all young people, how do we share that information in a safe way that won't kind of like bring this fear and harm from other folks that aren't for this, right? Like, how do we keep that safe? So yeah, that's what came to mind for me. You shared that.
Yeah, I thank you, Robert, echoing Christy what she's saying in response as well. And it also made me think what you were saying about people really wanting to go where they're already accessing services. And sometimes that's possible and that's amazing because they don't have to go to a new place. And sometimes it's not. And so the hope too with this referral toolkit is being able to build up your referral network, knowing where these places where adolescents will feel safe to go to. Because we know when students have had negative experiences at a certain clinic or a certain service, that they're not going to go back. And so we want to make sure that we have this referral system that's robust enough so that even students and adolescents are contributing to it to say this was a good referral, this was not a good referral, so that we know where students and adolescents want to go.
Yeah, thank you for that. I also dropped in the chat, sorry that it's not like a direct clickable link. If you copy and paste it into your browser, it'll show up. But that's that minor consent for STI services resource sheet that we had put together that could help with messaging and language and talking points for folks that might be facing some challenges around minor consent and STI testing and services in general. All right. Well, if we don't
Not
have
to
any
be
other,
all,
oh, go ahead.
I
Go
was
ahead,
gonna say,
Robert.
well, not to be all chatty here, but I was reminded along the way, I had an experience a couple of years ago. Before and during the pandemic, I was living in a small town in Oregon, and I went to the local cafe and knew some of the people who worked there, who were almost all under 21. And one of them kind of knew I was a crazy old gay guy, so he felt comfortable talking to me, and he asked me whether he should get the COVID vaccine. And the context was that his parents were a very conservative evangelical family, and they were against getting vaccines. And so the first thing I thought to ask him was how old he was, because I felt if I found out that he was under 18, I don't think I wanted to give him any advice on this subject. And then I found out he was 18. And so we talked a little bit more about it. But that was just something that this discussion made me think of.
Yeah, and I think the pandemic really highlighted, um, like, right, like looking at minor consent, not only for um, other services or related to sexual health, but like the COVID vaccine and like even the Mpox vaccine, right? Because we found like last year with when Mpox um, was really prominent last summer, young people were reaching out saying, "Well, am I old enough to get this vaccine? Do I have to tell my parents?" Right? Some of the work that we've engaged with HPV vaccines, I think that that question has always come to mind. And so, yeah, I could agree and see where your hesitation would come from. Like, if I can I even share this information? Will I get in trouble because this person is under 18? So I think it's just a matter of um, referring to your specific state and just minor consent. But young people have access to more than we would think that they would. But a lot of times, right, with some folks that are not for young people having that autonomy and agency to make health decisions, they don't share that information. So yeah, that's a really, really good point to think through. And I think, yeah, COVID really highlighted young people saying, well, what can I get myself? What can I access without my parents knowing?
Hey everybody, how y'all doing? This is
Hey, Johnny,
from MDHHS. How you doing, Christy?
so good to
You
see
brought
you.
up some really good points. I really enjoyed that presentation. But it got me to thinking a little bit. We had a couple of situations, not many, but it happens on occasion where I'm coordinating school-wide screening event, and you may have some parents that come after the fact when maybe the students got their results or they haven't got their results as of yet, and they have some serious concerns about how the student was screened, and then the laws around minor consent. And then sometimes, you have some school systems and administrators who might be a little bit against having that type of screening event there because they feel like it will bring a bad light on the school or something of that nature. So I guess if you could just maybe speak to that whole issue of minor consent. I know it's different in each state, but how you sometimes address that issue with parents that have some of those concerns and reservations about their youth getting tested.
Yeah, that's a really good point. Thank you for sharing that. So what we found in like kind of putting this resource together, because essentially we had a state that was facing some negative attention around minors, right? Like seeking testing services and parents feeling like, oh, well, I should have like minors should not have access to this. I'm the parent, like this is my right, right? So some of the top line messages that we really found around this is that what we want to emphasize is that minor consent laws doesn't take away parents' authority, right? Like the fact is that most parents do engage in their child's health care and some of those needs, that these laws offer protection to minors who could be experiencing like abuse or just other privacy fears. And so I think it's just really important to consider like that messaging and saying that we want parents and families to be engaged in this. We're not hiding anything. We're not being spooky or sneaky. Like this is what the minor consent law lays out for our state. It's to ensure that they can be affirmed in their decisions. It's backed by decades of research and major medical organizations that we know that privacy concerns might be a reason why young people might skip healthcare services or seeking out the cares that they need. And so while we want young parents to be engaged and, fully informed in some of this, that minors do have this um, protective factor to seek the care that they need. So I think it's just important to just kind of just share, have conversations with folks to say, hey, we're not doing anything sneaky. This is all the information around it. We want you to engage. We want to encourage conversations with you and your young person. We can help with facilitating safe spaces for some of those conversations, but then also like having that law and informing young people like these are your rights, and we just want you to be able to access your care in a private and safe way. So I think that that's what we've found to be helpful. And then once you have those conversations, literally those fires of like rage and like they kind of dim down a bit. So
Absolutely.
Yeah,
Okay, thank you for that. Appreciate it.
yeah, for sure. I'm curious, when y'all have your like school-wide, like maybe outreach events, how
Mhm.
do you communicate that to like families and parents that this is taking place
Sure.
or
So
whatnot?
with our school-wide screening events, especially within Michigan, we really make sure that we follow the guidelines of making sure the parents receive an opt-out letter for that. So if they don't want their student to participate in the school-wide screening event, they will have to opt out for that. Sometimes parents have, misunderstanding of that. They say, "Oh no, I'm signing this so they can be tested." No, this is only to opt them out, and it's just for that day, because at any other day and any other time that the student wishes to be tested, they can still access those services at that school-based health center. But I always try to impress over to parents, like, a lot of times having these types of events and allowing the students to be able to come down and get tested upon their own free will, and making sure that they're receiving confidential service is important and essential to them taking responsibility for their sexual health. I notice a lot of times parents feel like that, we're either trying to impress this information on them, or we're trying to get them to think a certain way, or to leave them out of this whole process, but understanding that their youth also has rights on top of the rights that they have as well as a parent. So kind of helping them understand this allows them to help them take responsibility for their sexual health, and really prepare them for adulthood, and preparing them for those times when they become an adult, or when they make those choices, if they're abstinent, when they make those choices to engage in sexual activity. Now they know the risks that come along with that, and the responsibilities of being tested after that sexual activity has occurred. So sometimes it's a little bit hard with parents and even sometimes administrators, but I always try to reach out to other folks in this field that's doing the work, to try to see how sometimes they address those, and having those conversations with parents, to kind of putting them at ease and helping them understand this is in the best interest of their student. And it's not something we're doing just because we want to get in their business or get some information from them without them knowing.
Yeah, thank you, Johnny. I so appreciate you sharing that. And like I think just to close this out, just this message that comes to my mind is like, let's create these systems and have them in place for the young people that need to access them. If that particular young person doesn't need those services, then they won't, engage in them. But if they do, that they're there, and that, we want families and parents and communities to be involved to create a healthier and safer community and school system in general. So thank you. And thank you everyone for your engagement on this work, and just all of the work that you're doing to support young people in these spaces. We know that it's not easy, but we so appreciate all that you do. Stay connected with us. There's a survey at the end. Please fill that out, because that helps inform future webinars. And yeah, we're excited to connect with you all again for part 2 in a few months. Thank you, everyone.
Thanks, everyone.